My name is Shreyas Singh, and today I'll be presenting my research on asthma-related risks associated with poor housing conditions in Paterson, New Jersey. African Americans in ages 5 to 15 were heavily represented in amongst my community, which is around 25 to 30% of the population in Paterson, New Jersey. In addition, 4,000 students were represented in the local K-12 schools. For my community, I also picked individuals with low socioeconomic status, as Paterson has around the 26.3% poverty rate, which can increase asthma risks. So looking at the environment, Paterson, New Jersey has around a 17K to 40K people per square mile ratio, which is indicative of overcrowding. The AQI ranges around 25 to 54, which indicates moderate air quality. In addition, a lot of these poor neighborhoods are industrial hot zones with factories and intricate highway systems surrounding it. So the major health issue, which my research was based upon, was asthma, linked towards African Americans and adolescents. And what we've seen is the poor housing can increase the asthma risk by around 45%. And a lot of these cheaper houses have increased pollutants, mold, and pests, which can increase asthma risks. In addition, African Americans have around a 3 times increased prevalence of asthma, making them a high group of vulnerability. So some of the researchers that were heavily influenced by my research were H.K. Hughes, E.C. Matusi, as well as C.A. Keene, which were all representatives of Johns Hopkins University studying asthma disparities. And one of them in interventions they recommended were using community advocacy to increase awareness, as well as improving the air quality localized in poor housing conditions. So one of the benefits of community advocacy and the interventions is it includes and incorporates cultural humility as it partners with local churches as well as various religious centers around Paterson, New Jersey to ensure access to all cultures. In addition, a lot of the volunteers for those organizations that do health checkups, AQI checkups, etc., are from several different cultures representative of cultural diversity. Some of the benefits that can come with community advocacy intervention is the increased awareness of asthma risks and how air pollutants contribute to asthma towards the population of Patterson. It increases access to cheaper home evaluations and it improves healthcare support by distributing the healthcare resources towards poorer neighborhoods. So looking at past intervention success, an organization of Airlines Houston created a similar intervention organization by creating a union. And what this union did is they pushed new agendas and forced these governments around Houston to improve environmental injustice by persuading them to pursue new laws which can lower the amount of factories as well as intricate highway systems built around these neighborhoods, improving the AQI. In addition, the improved house evaluations have been shown to improve air quality in general, localized amongst Houston housing issues as well as Patterson housing issues. So to market this intervention, the idea that I considered was through school nurses as well as school assemblies, because this has a direct interaction with these younger students in these schools, and it can further be spread to parents, families, and these students can help motivate their parents or families to improve their quality standards. In addition, these stakeholders hold campaigns and have group seminars allowing for this debate or questionnaire type of scenario, which allows people to ask questions and see how they can improve and play their part in improving air quality. For the evaluation, we did pre and post surveys asking questions in regard to how air quality is before the organization was incorporated and established, and how it was after to see the general trends. In addition, we tracked AQI changes as well as acquired data for a number of ER visits to see the amount of asthma severe cases amongst my community. The upstream approach of an intervention like this is it can improve environmental regulations, strengthen housing policies, expand houses, fund for frequent house quality checks, as well as build new housing in general to improve living conditions. In the future, if I was to modify my intervention, I would incorporate more direct interviews so we can get a more personal opinion on this, as surveys don't have a strong qualitative or quantitative data as compared to a direct interview standard. In addition, it can help them voice their opinion and give recommendations to improve how we evaluate and how this organization works as a whole. My role as a health educator in this research was that I used evidence-based research in order to establish the appropriate interventions for Patterson, and I heavily involved stakeholders to discuss about topics that were assessed needs amongst Paterson, New Jersey. In general, I hope in the future this paper can be used as a foundation for future asthma prevention projects and to help similar communities across the US, as it can be a basis for other aspiring organizations to do certain methods and ideas in order to address this environmental injustice as well as poor AQI that is localized with poorer housing conditions.